Hello friends, how are you? Today we are going to discuss about sickle cell anemia. It's very important topic. Here in sickle cell anemia, actually we are going to discuss about what is sickle cell anemia and how they are caused, like what are the causes of sickle cell anemia and what are the symptoms of sickle cell anemia, and test what type of major test we use for the sickle cell anemia, and next the basic treatment for the sickle cell anemia we are given to the patient. So let's go start with what is sickle cell anemia. As you know from name, sickle cell anemia means human hemoglobin deficiency. When will hemoglobin deficiency will occur? When there is some kind of disease will occur with hemoglobin molecules in our blood. There is lot of hemoglobin is present for carrying oxygen and necessary nutrients. Okay, in sickle cell anemia what happened? There is like change the shape of RBCs from biconcave to sickle shape. As you can see the in the name, there is like sickle is there sickle shape. The sickle shape is like pointed structure which can irritate our epithelium cells in our vessels, so it cause problems, it cause severe problems in body. So first is sickle cell anemia. Sickle cell anemia, this is the mainly sickle. In this anemia, the HbS means hemoglobin sickle, HbS amount is increased. Okay, these all come under what is sickle cell anemia. Now hope you understand what is sickle cell anemia. Mainly basically change the shape of RBCs. Then how, what are the causes of this anemia, like how this anemia is caused, and what are the, like in this anemia the our RBC is contained of, like hemoglobin is contained of RBC is contained of hemoglobin, and hemoglobin is contained of alpha beta chains. In sickle cell anemia what happened? In beta chain, in beta chain of hemoglobin there is like replacement of one amino acid to another amino acid, the at the sixth position. You know what amino acid is converted? That's the key point here. Like glutamic acid is converted into valine, means G is replaced by V. Glutamine is replaced by valine. Next thing, that's the main thing about the sickle cell anemia. The names of sickle cell anemia, lot of questions come on names of sickle cell anemia. Sickle cell anemia is autosomal mutation, means this is a mutation. Next, we can say sickle cell anemia is point mutation, because only one amino acid is replaced by another in the triplet codon. Next thing is, we can say also missense mutations. This one is little complicated name and question come always mostly on this. Always remember this is point mutation, autosomal mutation. Next is think about like what are the clinical causes, clinical representation of this disease. Now we are going to what are the causes we mention here. Now we are going to what are the symptoms in the sickle cell anemia. Sickle symptoms: patient have severe pain, crisis, we can say crisis, In sickle cell anemia, patient have crisis, severe pain. Means this severe pain mostly occur at the thigh bone and backbone. And sickle cell anemia also cause lot of severe these are the main places, but also pain like most on different places also, like renal infection because of that. And because of that, pulmonary infection will occur. Pleuritic pain will occur. Next, it may cause stroke in the brain. Because of some of the damage or blockage of the carotid artery near the neck. And next is the main point, is also called jaundice, cause jaundice. How they cause jaundice? In case of sickle cell anemia, there is rapid disruption of RBCs. Always remember, rapid disruption. Because of this rapid disruption, the heme is free heme is produced, and this free heme is formation of unconjugated bilirubin, which cause further jaundice. This RBC will formation of free heme. This will cause jaundice. Next thing, as we mentioned upper, like we are discussed here symptoms, what is sickle cell anemia, caused by sickle cell anemia, symptoms of sickle cell anemia, clinical symptoms. Next we are going to discuss about test, what are the major tests for the sickle cell anemia. Actually, the major test which we discuss for the sickle cell anemia is like check by electrophoresis, check the shape of RBCs. And on the higher level we can check presence of pyrovirus. In the blood. And in I will also mention here, like because of sickle cell anemia, the bacterial infection will occur. In bacterial infection, aseptic vascular necrosis will occur. Like here we study like stroke in the brain, and here I mention more things like peripism. Because of in sickle cell anemia, the painful erection will occur. Because of this painful erection, next one is like septic shock or bacterial infection, aseptic vascular necrosis. In thighs, this mainly occur in thighs. Aseptic vascular necrosis. Always remember, the encapsulated bacteria only cause sickle cell anemia necrosis. You remember the names of encapsulated bacteria? Think. Actually, the encapsulated bacteria are Streptococcus pneumoniae, Streptococcus pneumonia, Haemophilus influenza, these also are the symptoms of, like, what are the causes in the sickle cell anemia, what happened with our body. Next we are on the in the test like pyrovirus, and we are checking the pyrovirus in the blood, and like next one is the electrophoresis. We check the from the electrophoresis. This is a test for more many things, and like if in PCR we check through PCR this pyrovirus. Next we are going to study about the treatment of the sickle cell anemia. What are the major treatments we give for the person in sickle cell anemia? As you know, in sickle cell anemia what happens? Severe crisis will happen. In severe crisis, during first initial stage, doctor give the patient mostly like oxygen and normal saline for pain relief. O2 and saline for normal saline for pain relief. But one thing is here, like several drugs also given for the severe crisis, like patient can't tolerate this crisis, we give hydroxyurea. But this drug has major side effects also, and this decrease the crisis in the sickle cell anemia. And also prevent prolongation of disease. Prolongation of. Next thing is that what are the side effects of this drug? This drug mainly increase the amount of fetal hemoglobin. Increase the amount of fetal hemoglobin, and the second thing is they cause microcytic anemia. This drug will cause microcytic anemia, or we can say vitamin B9 deficiency. So here we discuss about the little about the sickle cell anemia and the main concept. Make sure if you like this video, please share this video with your friends. Thank you all. Share and subscribe. Share and subscribe this video. Thank you all for your support. Have a nice